Hi, and welcome to Madness and More. Today, we're going to be discussing Huntington's disease. So, let's begin. So, what is Huntington's disease? Huntington disease is a brain disorder in which brain cells or neurons in certain areas of your brain start to break down. As the neurons degenerate, the disease can lead to emotional disturbances, loss of intellectual abilities, and uncontrolled movement. Huntington disease has two subtypes. Adult onset Huntington's disease, which is the most common form of Huntington's disease. People typically develop the symptoms in their mid-30s and 40s, and early onset Huntington's disease. In rare instances, children will develop the disease. Children with the disease tend to experience abrupt difficulties with schoolwork and often have symptoms that are quite similar to Parkinson's disease. So, what causes Huntington's disease? Huntington's disease is a genetic disorder. It is passed on from parents to children. If a parent has Huntington's disease, the child has a 50% chance of developing it. If the child doesn't develop the disease, he or she won't pass it along to their children. For 1% to 3% of people with Huntington's disease, no family history of the disorder is ever identified. What are the symptoms of Huntington's disease? Well, the early symptoms of Huntington's disease are often general, like irritation, depression, mood swings, trouble driving, trouble learning new things, forgetting facts, and trouble making decisions. As the disease progresses, the following symptoms become more common: trouble eating, difficulty swallowing, strange and uncontrolled movements that are either slow or wild and jerking, loss of memory and judgment, changes in speech, personality changes, disorientation and confusion, and hallucination or psychosis. In children, the symptoms often include Parkinson's disease, like features such as slow movements, rigidity, and tremors. How is Huntington's disease diagnosed? Well, because many of these symptoms can be caused by other diseases, a detailed physical and neurological exam is usually needed. Not surprisingly, a family history of the disorder is often the biggest clue that you may have Huntington's disease. Special blood tests can help your healthcare provider determine your likelihood of developing Huntington's disease. A computed tomography or CT scan of the head can evaluate the scope and the scale of brain cell damage and the loss of brain tissue. A magnetic resonance imaging (MRI) scan or a positron emission tomography (PET) scan may be used. You may be wondering what some risk factors of Huntington's disease are. If you have the Huntington disease gene, you will develop the disease at some point during your life. The age of onset of Huntington disease varies greatly from person to person, but most develop it in their 30s to 40s. Huntington disease is a rare disorder. More than 15,000 Americans currently have the disease, but many more are at risk of developing it. So how is Huntington's disease treated? You can cure or slow the progression of Huntington disease, but healthcare providers can offer medications to help with certain symptoms. Drugs like haloperidol, tetrabenazine, and amantadine are especially helpful for controlling the unusual movements caused by Huntington's disease. Haloperidol or tetrabenazine can also help offset hallucinations and delusional thoughts. Depression and suicide are common among those with Huntington's disease. Antidepressants and anti-anxiety medications may be prescribed to treat these symptoms. Living with Huntington disease. As Huntington disease progresses, you will need constant assistance and supervision because of the debilitating nature of the disease. People usually pass away from the disease within 15 to 20 years of developing symptoms. If you have been diagnosed with or are at risk for Huntington disease, it is critical to maintain your physical fitness as best as you can. People who exercise regularly and stay active tend to do better than those who don't. A number of studies are currently underway to examine possible therapies for Huntington disease. Talk with your healthcare provider about whether any of these therapies may be helpful to you or a loved one with the disorder. When should I call my healthcare provider is a common question. If you have Huntington disease, it is important to closely monitor your condition and contact your healthcare provider if you have noticed any of the following symptoms: increased difficulties with motor tasks such as walking, trouble swallowing, and mood changes such as an increasing symptoms of depression or feelings of suicide.
Thank you for watching, and don't forget to like, share, and subscribe.